I'm Steve. I'm going to be demonstrating how to insert an IV, peripheral IV. So before I go into the patient's room, I'm going to check the orders from the physician. The physician does indeed want an IV started on this patient for antibiotic administration. So I'm going to get all my supplies gathered together, and I'm also going to check the chart to see if he has any known allergies that are listed in the chart. So things like iodine, betadine, CHG, or latex would be important for this procedure. So if you had any of those allergies, then I would have to find some suitable replacement materials here. So, got everything set up. We're going to knock on the patient's door and come on in. Hello, sir. How are you doing today? Good. My name is Steve. I'm a student nurse here at NTC, and I see that doctor has ordered you to have an IV inserted. Are you going to be okay with that? Great. So, provide for privacy. Wash my hands. So now, indicate to me, sir, which is your non-dominant hand. And he says that it is this arm that is closest to me here. All right. Are you able to lift up that arm, move it around on your own? Great. Are you going to be able to keep that arm straight as I'm inserting a needle? Good. Can you verify your name and date of birth for me? He does, and it matches the wristband, and it matches the chart where I got the orders from. And do you have any allergies? He says he has no known allergies, so we're clear to go here. So, first thing I'm going to do, put a drape underneath his arm. If I could have you lift up your arm for me, sir. I'm just going to place this underneath to catch any thing that might dribble off. Got the mat placed, and I'm going to place the tourniquet underneath his arm. I'm not going to tie it quite yet because we don't want to leave that tourniquet in place for any longer than 2 minutes at a time. And I'm going to kind of assess his vein. I'm going to choose this vein here because it's looking pretty straight and it's far enough away from any joints that would cause a problem when he bends his wrist or bends his arm. And with that, I'm going to get the rest of my supplies prepped here. So the first thing I'm going to do is I'm going to prime my saline lock. So I'm going to squeeze the air out of my flush air. There we go. I'm going to take my new saline lock here, open it up. Haven't touched anything yet, but I'm still going to swab off that port just to make sure that everything is nice and clean. And we're going to wait for that to dry, probably about 30 seconds or so. Put my flush on there, and we're going to prime it, so make sure we get all the air out of there. Now, if this were truly a brand new saline lock, it would have a cap on it. So, but I would still want to loosen the cap up so that when it comes time to using it, it's easily accessible. I'm just going to place that back in the packaging, and I'm going to place that on the mat near the patient so that it's handy for me. All right, everything else is prepped. I got my Tegaderm, I got my needle. I'm going to get my alcohol preps ready. I even have my tape ready to go here as well. So I got my tape hanging on the side of the table here so that it's ready for me to grab. So we're going to tie the tourniquet. So we're going to check to make sure we haven't cut off the arterial blood flow. He still has a pulse. It's good. I'm going to have him make a fist and release a few times to kind of get that vein pumped up. If that didn't work, I could try tapping on his arm to get the vein to pop up closer to the surface. If that didn't work, I would remove the tourniquet and put a warm blanket on it, dilate the vessel, wait for it to come closer to the surface, probably about 10 or 15 minutes, and then make an attempt with the IV. So, I'm wash my hands. I'm going to put on my fresh set of gloves here. And then we're going to swab the site and then get the needle going here. So, and our clock is ticking because we want to get this done before we get to our 2-minute mark with our tourniquet. So, I got my alcohol swab. We're going to start in the middle, swab towards the outside. I'm going to let that dry for about 30 seconds. Take my needle, got the cap off of it already, and I'm going to place my non-dominant hand. I'm going to apply pressure on the vein to stabilize it. And we're going to start going in at a 15-degree angle until we see blood return. And we got blood return, so now I'm going to bring the needle down closer to parallel, going about a half a centimeter more. Now I'm going to advance the catheter in all the way to the injection site. There we go. I'm going to stabilize the catheter with my non-dominant hand, release the tourniquet, grab my saline flush, take the cap off, remove the needle, and attach the saline flush. Here we go. Normally I would have retracted that needle, but since this is a demonstration purposes, I'm hoping to reuse that needle. So, got that. I'm going to secure the line, like so. We'll flush to make sure that it's patent. Good. And fluid is going in there. There's no resistance. Excellent. I can go ahead and clamp that line. Leave the flush there. Now we're going to put on the tegaderm. Holding it by the edges so we don't contaminate the dressing. We'll go right over the IV site, like so. Remove the paper. And I would use this label here. I would note the date and the time of my initials. Apply that there. Take my other piece of tape, further secure the line. Try not to lock that, try not to tape that lock down. Remove my flush. Gather up my supplies. Like so. And we're just going to leave the saline lock attached for now. The antibiotics have not arrived yet, so when they do, we'll get them hooked up to that. You know, every so often, according to facility policy, we're going to have to flush this IV site just to make sure that it's patent, even if we aren't running any fluids, especially if we aren't running any fluids. And so I'm going to remove this stuff here. Remove my gloves, wash my hands, let's go in the garbage. Provide for patient comfort and safety, so side rails up, call light is in reach, bed is in the lowest position. I'm going to clean up all my supplies here, and then we're going to chart. And I'm going to document the date and the time of the IV insertion, the site of the insertion, the size of the needle, or size of the catheter that we used. How the patient tolerated the procedure, which he tolerated it well, how much saline I used to flush the line with. In this case, probably used close to 6 cc's, and how many attempts I made. This was one attempt. And I would ask the client or the patient before I left the room if he needed anything else, and if he said no and he was all good, then that would conclude this skill. Thank you.